Hello everyone, myself Tanishka Ranjan, member of Leo Club Naya Bazaar, welcomes you all for this enlightening session on cervical cancer with Dr. Varsha in association with EduMound. Dr. Varsha is a senior obstetrician and gynecologist in Muzaffarpur, having more than 10 years of experience. She did her MBBS from Dhanbad and MD Obs and Gynae from Institute of Medicine Kathmandu, Nepal, and subsequently cleared MRCOG. She also worked as a lecturer at Nopal Medical College, Biratnagar, Nepal from 2011 to 2015. Since 2015, she is serving in life care nursing home and also is associated with Kejriwal Hospital, Muzaffarpur. Unfortunately, women in India meet doctors at last resort, and health is often considered by them as an unaffordable luxury. Breast cancer, ovarian cancer, and uterine cancer account for almost 70% of the cancer which affect women in India. But each gynecological malignancy is unique with different signs and symptoms, different factors, and different preventative strategies, but with one thing in common, that is, if detected early, the treatment can be effective. Without any further delay, we will begin with the cervical cancer, which is the most common cancer among the women. Especially women over the age of 30 faces this problem in India because of lack of awareness among the citizens and less knowledge about such things. It claims life of one Indian woman every 8 minutes. To gain more knowledge about this, we welcome you, ma'am. Thank you for accepting our invitation and joining us for spreading awareness regarding different health issues. To begin, I would like to call upon Ms. Vinda Agarwal, President of Leo Club and the co-founder of EduMound, to take this session forward. Over to you.
Thank you, Tanishka, for this amazing introduction, and thanks for joining us, ma'am. I welcome you all after a long break, and yes, a happy Independence Day in advance.
Thank you,
So,
Tanishka. Thank you, Rita, for amazing introduction. And good evening, ladies and gentlemen. So, Vrinda will be introducing the topic.
yes,
Vrinda?
मैम सो मैम एक्चुअली सर्वाइकल कैंसर आज के डेट में काफ़ी ज़्यादा एक बड़ी प्रॉब्लम हो गई है. तो सबसे पहले मैं चाहूँगी कि हमें ये पता चले कि आखिर ये सर्वाइकल कैंसर क्या होता है.
So, today we will be talking on a very important topic, that is cervical cancer. First of all, I will be telling you what do you mean by cancer. Cancer is the abnormal growth of cells which can occur in any part of the body. So today we are discussing on cervical cancer. First of all, we should know what is cervix. Cervix is that part of the uterus which is between the body of the uterus and the vagina. ये जो पार्ट होता है सर्विक्स, ये इसको हम लोग माउथ ऑफ द यूट्रस भी बोल सकते हैं. यूट्रस को हम लोग जनरल टर्म में बच्चेदानी बोलते हैं. बच्चेदानी का जो लोअर मोस्ट पार्ट होता है जिससे हम माउथ ऑफ द यूट्रस बोलते हैं, उसके कैंसर को हम लोग सर्वाइकल कैंसर बोलते हैं. Why the cervical cancer is very important? Because this is the second most common cancer which is common in India as well as worldwide. So it's very important for all the females because ये cervix जो है वो सिर्फ females में ही पाया जाता है. यूट्रस सिर्फ फीमेल ऑर्गन है, रिप्रोडक्टिव ऑर्गन है. सो हमें हम सारी फीमेल्स को सर्वाइकल कैंसर के बारे में काफी अच्छे से पता होना चाहिए. So as we all know that it is second most common cancer in females worldwide, but the incidence of cervical cancer is decreasing. Though it is second most common cancer, but the incidence is decreasing day by day. Why it is decreasing? Because of the increased awareness. Because पहले जो females आती थी हमारे पास बहुत शर्म करती थी, कुछ अपने प्रॉब्लम्स बताती नहीं थी. इनफैक्ट वो लोग घर में ही रह जाती थी. जब भी आती थी हमारे पास एडवांस स्टेजेस में आती थी. तो अब जो फीमेल्स हैं काफ़ी हेल्थ कॉन्शियस हो गई हैं, हेल्थ ओरिएंटेड हो गई हैं, तो दे कम इन द अर्ली स्टेजेस. सेकंड, बहुत अच्छे स्क्रीनिंग प्रोग्राम्स डेवलप हो गए हैं सर्वाइकल कैंसर डायग्नोस करने के लिए या प्री कैंसरस कंडीशन में जानने के लिए. जो सर्वाइकल कैंसर की एक अच्छी बात क्या है कि इट हैज़ अ लॉन्ग duration of development from pre-malignant to malignant state. It takes near about 10 to 15 years. So हमारे पास काफी टाइम होता है इस समझने के लिए, डिटेक्ट करने के लिए. Proper screening methods are available, and third is the vaccine. बहुत कम cancers हैं जहाँ पे vaccines, जिसके लिए vaccines developed है. We are very fortunate, we all the females are very fortunate that हमारे इस cervical cancer के लिए vaccine है. अगर हम properly अगर इस vaccine को देते हैं तो हम cervical cancer को काफी हद तक prevent कर सकते हैं. हमारा जो burden है, global जो burden है cervical cancer का, वो काफी कम हो सकता है. So this is the awareness and the vaccination and the screening, which is very important in case of cervical cancer. So सबसे पहले तो मैं ये बताना चाहूंगी कि जो सर्वाइकल कैंसर है वो कैसे स्प्रेड होता है, कैसे होता है. दिस इज सबके मन में ये आ रहा होगा कि सर्वाइकल कैंसर होता क्या है. सो सर्वाइकल कैंसर जो है वो सेक्सुअल कॉन्टैक्ट से होता है. When a female is in sexual relationship with a partner who is infected with HPV virus, it is virus. The causative organism is the virus, that is the human papilloma virus. So if any female comes in contact with a male partner who is already infected with the human papilloma virus, then that female can get that virus and can develop cervical cancer later on. So who are the females who are more prone for this cancer? किस फीमेल्स में हम लोग सोचेंगे कि हाँ, इसे ज्यादा संभावना है सर्वाइकल कैंसर होने की? सो अर्ली एज ऑफ मैरिज. पहले तो काफी अर्ली एज में शादियां होती थी, लेकिन अब तो हम लोग डिले कर दिए, इसीलिए सर्वाइकल कैंसर का बर्डन थोड़ा कम भी हो रहा है. अर्ली एज ऑफ मैरिज, अर्ली एज ऑफ सेक्सुअल कॉन्टैक्ट, मल्टीपल सेक्सुअल पार्टनर्स. सो हमें हेल्थ एजुकेशन देना बहुत ज़रूरी है अपने बच्चों को, अपनी फीमेल्स, अपनी बेटियों को, कि अर्ली मल्टीपल सेक्सुअल पार्टनर्स कैन लीड टू सर्वाइकल कैंसर, अर्ली सेक्सुअल कॉन्टैक्ट, अर्ली एज ऑफ मैरिज, ऑल दीज कैन लीड टू सेक्सुअल कॉन्टैक्ट. अपार्ट फ्रॉम द सेक्सुअल कॉज देयर आर ऑल्सो नॉन सेक्सुअल कॉजेज लाइक ओसी पिल्स, जो हमें कॉन्ट्रासेप्टिव पिल्स अगर हम यूज करते हैं काफी समय के लिए, दैट कैन ऑल्सो लीड टू सर्वाइकल कैंसर. अगर हम स्मोकिंग करते, इफ द फीमेल्स आर smoking, that can also lead to cervical cancer. अगर लो सोशो इकोनॉमिक स्टेटस है, जहाँ पे हमारा इम्यूनिटी स्टेटस बहुत ही कम है, तो that can also lead to cervical cancer. These are the few non-sexual causes which can lead to cervical cancer. So अब हमें ये पता होना चाहिए कि what are the symptoms. हर कैंसर का अपना कुछ लक्षण होता है, कुछ symptoms होते हैं. Can you hear me, Vrinda?
Yes, I can hear you.
Okay.
Yes.
Okay. So I think the knowing the symptoms is very important कि क्या लक्षण होते हैं सर्वाइकल कैंसर के. हमारे जो रेगुलर पीरियड्स आते हैं, उसके अलावा अगर पीरियड्स इरेगुलर आ रहे हैं या हेवी पीरियड्स आ रहे हैं, पीरियड्स के समय अगर काफी ज्यादा ब्लीडिंग हो रही है ना, 10 to 15 डेज की ब्लीडिंग हो रही है, 8 to 9 डेज की ब्लीडिंग हो रही है, हेवी हो रही है, अमाउंट ज्यादा है, और अगर दो नॉर्मल पीरियड्स के बीच में भी अगर स्पॉटिंग या ब्लीडिंग हमें दिखता है, तो ये सब कैंसर सर्विक्स की संभावना हो सकती है. दूसरा इंपॉर्टेंट चीज है फाउल स्मेलिंग वजाइनल डिस्चार्ज. अगर पेशेंट कंप्लेन करता है कि गंदा पानी जैसा आता है, महकता है, तो सर्वाइकल कैंसर डिटेक्ट करना चाहिए, उसे अपने गायनेकोलॉजिस्ट से इमीडिएटली मिलना चाहिए. इन सब के अलावा अगर नीचे पेट में, पेरू के पास अगर पेन होता है या बैक एक होता है या पेन लेग्स में काफी एक्सक्रूशिएटिंग पेन्स होता है पेशेंट को, तो उस पेशेंट को ये सारे सिम्टम्स लेके पेशेंट को अपनी जो कंसर्न्ड गायनेकोलॉजिस्ट है या फैमिली गायनेकोलॉजिस्ट है उससे जरूर मिलना चाहिए, कंसर्न करना चाहिए, और वो अपना बताएंगे कि हाँ, कि whether the patient is moving forward for cervical cancer or it is just the normal symptoms which she is having. So this is all about the symptoms which the patient should be knowing about. So अगर ये सब चीजें हैं, the risk factors I told you, the risk factors are the early age of marriage, multiple sexual partners, smoking, and if all these are there, then the patient is more prone for developing cervical cancer. सबसे अच्छी बात है कि हमारे पास काफी अच्छे स्क्रीनिंग मेथड्स है, काफी अच्छे टेस्ट हैं जो कि इजीली अवेलेबल है. किसी भी हेल्थ सेंटर्स में इफ द पेशेंट गोज एंड हैव दीज टेस्ट डन, इट विल बी वेरी मच बेनिफिशियल टू देम. स्क्रीनिंग में सबसे इम्पोर्टेंट जो है वो पैप टेस्ट नाम से होता है. पैप टेस्ट इज अ वेरी सिंपल टेस्ट. Okay, any female can go to the health center. Actually, this pap test should begin from the age of 21 years or 3 years following the sexual contact. In this, the health worker or the doctor will ask the patient to lie down. A speculum is introduced into the vagina, and a spatula is taken, which might be a wooden or plastic spatula, and a cytobrush is there. That cytobrush and spatula is introduced inside the vagina, and from the cervix, the cells, or we call pani, वहाँ का हम लोग लेते हैं. We prepare it on a slide, and that slide is sent to the laboratory, and slide is seen under the microscope, and if any abnormal cells is there, it can be detected easily. So this is very important, very simple, cost-effective test which is available at all the centers. And if the patient undergoes pap test, it's not that one test is sufficient. It's not like that. The test should be done till the age of 65 years. Test has to be done till the age of 65 years. If once, for example, if I'm having my pap test today, then if it comes out to be negative, then again after 1 year we have to go for repetition. If the 3 consecutive test comes out to be negative, then the test can be repeated at the interval of 3 years till the age of 65 years. There are a few other tests which is of increased sensitivity. Those are better than the simple pap test, that is the liquid-based cytology. The advantage of this liquid-based cytology test is that we can detect the cells, abnormal cells, as well as the human papilloma virus can also be detected by these tests. If the patient is undergoing this test is a bit costly because everyone can't afford this test, but from this test we can detect both the things, abnormal cells as well as human papilloma virus. This test is done after 30 years of age, and if it comes out to be negative, it need not be done annually or at an interval of 3 years. It can be done at the interval of 5 years. So there is the third technique that is known as colposcopy, and if any of these tests comes out to be normal, we do colposcopy. In colposcopy, there is a scope which by which we see inside the vagina and at the cervix, and the abnormal presentation can be detected and the diagnosis can be confirmed, or it can be more clear about the cervical cancer. So these are the few very easy. These are not painful at all for the patients. These are very simple screening tests which is available, and if we go for these screening procedures, the burden of cervical cancer can be reduced 50 to 60%. So these are very effective. As I told you that screening procedures are very good because the duration of the development of cervical cancer बहुत लंबा होता है, 15 से 20 साल. So अगर हम screening is always done before cancer development. Okay, screening is the procedure which we do. So if we do proper screening at initial stage, we can prevent carcinoma cervix. So this is very important. अब एक क्वेश्चन दिमाग में आता है जिसके हिस्टेक्टमी नहीं हुई, हिस्टेक्टमी हो गई है, उसे स्क्रीनिंग की जरूरत है कि नहीं है. बहुत सारे पेशेंट्स होते हैं जिसके आजकल तो यूट्रस बहुत जल्दी जल्दी निकल जाते हैं, उसे स्क्रीनिंग की जरूरत है कि नहीं. जिसकी हिस्टेक्टमी हो चुकी है उसे स्क्रीनिंग की जरूरत नहीं है, लेकिन कुछ पेशेंट्स में सब टोटल हिस्टेक्टमी होता है जिसमें सर्वाइकल स्टंप को छोड़ दिया जाता है और ऊपर का पार्ट निकाल दिया जाता है, उसे हम सब टोटल हिस्टेक्टमी बोलते हैं. उन पेशेंट्स में जरूरी है फिर स्क्रीनिंग, बिकॉज दैट कैन लीड टू सर्वाइकल कैंसर. सो दिस वाज ऑल अबाउट स्क्रीनिंग. नाउ कमिंग cost is very it depends upon lab to lab. It is maximum between 4 to 500 and some labs are it's not costly, and it's cost effective, and some labs are causing even lesser 350 400. So now screening should be done till the age of 65 years, 3 yearly or 5 yearly. Okay, fine. Now coming to vaccination, that is very important, very 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 important. And actually as I told you that we females are very fortunate that we have vaccination for our cervical cancer. So सबसे पहले दिमाग में आता है कब देना है सर वैक्सीनेशन, है ना. तो बिकॉज सर्वाइकल कैंसर इज कॉज्ड बाय सेक्सुअल कॉन्टैक्ट, सो इट शुड बी गिवन before sexual contact, before the age of sexual contact or before the sexual contact. Vaccination is for prevention. not for the treatment of cervical cancer. By giving vaccination, we can prevent cervical cancer. Once the cancer is developed, we can't treat cervical cancer by giving vaccination. So it has to be given before the age of sexual contact. So the age of the patient should be 12 to 13 years. When we can give,
is a minimum age.
that is no, we can give even at age of 9 years.
Okay.
Few guidelines are telling that we can give vaccination at the age of 9 years, and most of the guidelines say that the vaccination should be given at the age of 11 to 13 years. There are two types of vaccines which are available for this. Cervarix, they come by the name of Cervarix and Gardasil.
Okay.
Both are equally effective. Gardasil protects against 4 strains of virus. Cervarix protects against 2 strains of virus. So if we give Gardasil, which is protecting against 4 strains of virus, we can prevent other carcinomas like vaginal, vulval, anal. ये सब को भी हम लोग prevent कर सकते हैं. Cervarix is against only 2, which is the main causative organism for the cervical cancer. So anyone can be given. The schedule of this is, it has to be started at the age of 11 to 13 years. 3 doses are there, 0, 1 and 6. If we give a vaccine today, then at an interval of 1 or 2 months we give the next dose, and then at an interval of 6 months we give the third dose. The good point is that if we give the vaccine before the age of 14 years, then only 2 doses are given, only 2 doses are required.
Okay.
And if we give after the age of 14 years, then we have to give complete 3 doses.
Okay.
Vaccination is very, that is the difference. If we give at proper age, then only 2 doses are sufficient.
Otherwise,
Okay, and
doses need to be given.
Otherwise 3 doses. Vaccines, अब बहुत पेशेंट्स बहुत घबराती हैं, वैक्सीन दे देंगे, कुछ होगा तो नहीं, साइड इफेक्ट्स है कि नहीं. It's not. There are no side effects. It's absolutely safe. पहले जब ये इंट्रोड्यूस हुआ था, it was very costly, but now the cost of per dose is more or less, I think, 2,500 or 3,000. So it
It's
has
like
decreased
one
a
can
lot.
have it.
Yes, we are. भगवान ने हमें गिफ्ट दिया है ये.
और we should
realize gift given by God, that we have very good, very efficient vaccine for cervical cancer. It can prevent up to 90% of the cervical cancer. So it's very, very, very extremely good. And all the females, all the parents should vaccinate their female child. It's very important. At the age of 11 to 13 years, and if earlier, they can go at the age of 9 years also.
And the maximum is before the sexual intercourse.
And definitely, it has to be given before the sexual intercourse, before the age of sexual contact. Otherwise, it won't be much. It can be given till the age of 45 years.
Okay.
But the protective value is less. It is not very efficient. बहुत efficient नहीं है. जो हमारा purpose है वो बहुत solve नहीं हो पाता है. तो एक चीज क्वेश्चन आता है मन में कि if we have vaccinated our child, then that child should be screened at regular intervals or not till the age of 65 years. आएगा दिमाग में आएगा ये चीज. But हाँ, लेकिन it has to be screened. They have to be screened. Even after vaccination, they have to be screened, because cervical cancer is caused by many strains of human papilloma virus. जो हमारे वैक्सीन्स हैं वो कुछ ही स्ट्रेन से प्रिवेंट करते हैं. जो मोस्ट इम्पॉर्टेंट स्ट्रेन है, स्ट्रेन 16 एंड 18, वो कवरेज दिया है वैक्सीन ने. लेकिन कुछ 5 to 10% जो अदर कॉजेज हैं, 5 to 10% भी मैं नहीं बोलूंगी, 1 to 2% अदर स्ट्रेन्स के कारण अगर सर्वाइकल कैंसर हो रहा है तो उससे प्रोटेक्टिव नहीं है. तो क्योंकि ह्यूमन पैपिलोमा वायरस 16, 18 जो कि हमारा वैक्सीन कवर करता है, 99% प्रोटेक्शन कवर करता है. ठीक है, बट स्क्रीनिंग इज इम्पॉर्टेंट फॉर दी अदर फ्यू स्ट्रेन्स, परसेंटेज ऑफ स्ट्रेन्स विच कैन कॉज सर्वाइकल कैंसर. इसीलिए स्क्रीनिंग तो होनी ही है. वैक्सीनेशन के बाद भी स्क्रीनिंग करनी है,
मैंडेटरी है. ये
मैंडेटरी.
वैक्सीनेशन ले लिया तो आई एम फ्री फ्रॉम the cancer?
No,
It
no,
can
we are not.
happen.
हाँ, it can happen. So
Yeah.
screening is very important. और आप intervals बढ़ा सकते हो बाद में screening की. अगर
Yeah,
negative
yeah.
आता है तो 3 साल पे 5 साल पे आप जा सकते हो, but screening should be done. Okay, after
On a
65 is
preventive
not.
side, yeah,
हाँ,
on a
preventive
preventive
side
side,
is
you should go for screening and as well as
screening.
vaccination before the
Vaccination तो है
age.
ही.
Yeah.
So screening and vaccination should go hand by hand, side by side. So it's both are very very important. तो ये तो था हमारा prevention.
Prevention.
और
Now I
prevention
would
is
also like to add, yeah, prevention
yes,
is,
better than cure.
yeah, absolutely. Also, the like, if I get the vaccination and the screening, what other things I can keep in mind to lower the risk of cervical cancer? Is there any particular things that we can keep in mind, or the ones you mentioned before, the risk factors associated?
The risk factors,
Like,
multiple sexual
okay,
partners, ये सब होना है, proper hygiene, proper education, और आपको अपना immunity boosters. Dietary, you can include flavonoids, carotenes, folates in your diet. All the green leafy vegetables, broccoli, cabbage, garlics, onions, and apple, citrus fruits. ये जितने भी soyas, ये सब dietary, you can improve your diet, that will improve your immunity. Rest everything is the same as the risk factors apart from
okay,
vaccination. Okay, so
yeah,
अब मैं treatment बता देती हूँ. most अगर
हाँ,
अगर patient को, because prevention is best है ना. If prevention,
yeah,
if you do
right, right,
prevention, then you will not reach up to the stage only, but
yeah.
there are many stages, there are
अगर
4
हो
stages
गया,
of. हाँ, अगर हो गया तो, अगर देयर मेनी स्टेजेस ऑफ कैंसर सर्विक्स, 0 स्टेज भी है जहाँ मैंने बोला कि वो प्री कैंसरस स्टेज होता है, जहाँ पे प्रिवेंशन इज
हाँ,
इम्पोर्टेंट. और स्टेज 1 to 4 होता है. 1 is the when the cancer is limited to the cervical part, and stage 4 when it has gone to the advanced stage. And अगर हम प्रॉपर ट्रीटमेंट कराते हैं, प्रॉपर ट्रीटमेंट में सर्जरी, रेडियोथेरेपी एंड कीमोथेरेपी, these 3 modalities are there. सर्जरी में हम लोग अगर हिस्टेक्टमी में ना जाना चाहें या ना जाने की जरूरत पड़े, तो there are many ablative procedures like cryosurgery and leap. अगर है कि वहाँ के localized हम लोग टिश्यू को डीपली उसको निकाल दें. और ये सब इनिशियल स्टेजेस के लिए ही है, जब इनिशियल स्टेज 1 के लिए ही है. और अगर 2B के बाद 2B ऑनवर्ड्स अगर स्टेज है तो उसके लिए सिर्फ रेडियोथेरेपी ही बना है. और 2B से पहले है तो सर्जरी एंड रेडियोथेरेपी बोथ आर इक्वली इफेक्टिव. और साइड इफेक्ट्स तो किसी के भी हैं. रेडियोथेरेपी का प्रॉब्लम है कि समटाइम्स इट कॉजेज वजाइनल स्टेनोसिस, यूट्राइन को थोड़ा सिकुड़ा देता है, जिसके कारण एमिनोरिक हो जाती है पेशेंट, पीरियड्स नहीं आते हैं. और अगर वो सिकुड़ गया, स्टेनोज्ड हो गया, तो प्रेगनेंसी पॉसिबल नहीं होती है. So these are the few complications of radiotherapy, which is the main modality for cervical cancer. Otherwise, chemotherapy is also there, and in the initial stages, surgery is also good. Both are equally, surgery and radiotherapy, both are equally effective. So this was about the treatment. And if the patient is diagnosed in stage 1, then the chances of survival, the 5-year survival rate is 80 to 90%. And as the stages get advanced, the 5-year survival rate goes on decreasing. So though it is a deadly cancer, but we can prevent this cancer to a great extent. So on this Independence Day, on the 75th Independence Day of India, I would like to convey this message to all my female patients, all the mothers, all the daughters, all my friends, that just by adopting 3 weapons, that is education to your female daughters, educate yourself about this cancer, proper screening methods, and taking proper vaccination, timely vaccination may prevent the burden, may decrease the burden of cancer cervix in our country to a great extent. So this was my take-home message for all my colleagues, all my female patients. So let's hope we will reduce.
Even to all the males out there, it is a great message for your wives,
for your
children.
daughters, for your
Yeah.
Yes, definitely to everyone in our country. So let's take a pledge that we have to reduce this burden of cervical cancer, and we have to make our country cervical cancer free.
Free, right.
Yes.
When there is a step, when there is a preventive measure, we have a vaccination available for it. We should definitely go for it.
Yes, 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 yes. So, thank you,
So,
Brinda. Thank you,
thank you,
everyone.
ma'am. Thank you. It was a wonderful session. I hope from this everyone gets to know that cervical cancer can be treated, and if taken proper care, and also at an early age if they have recognized it or have taken proper steps. So, yeah, thank you so much, ma'am. Thank you,
Thank you.
everyone,
Thank
for
you for giving
joining
me this
us.
opportunity. Thank you, Brinda. Thank you so much.
Thank you so much, ma'am. Thank you. Goodbye, everyone.